Good morning. So glad to have you with us for this special edition of the HealthCall Live Radio Hour. We are devoting the hour to healthcare workers. We want to hear from you, listen to your stories of how you're coping with COVID-19, not only professionally in the workplace, but also personally and emotionally. You know, it takes a big toll on people, not just at the job, but also at home. I've talked with enough people to know that after you've been in that PPE for 12 hours, 3 days in a row, that 36 hours feels like a lot more because of the stress that you're feeling just hour after hour of being on the job, on the front line. So we have this hour devoted for you. We're opening the phones at 800-333-1190, inviting you to call and tell us exactly what's going on in your world. And that applies even if you're not working in a clinical environment. It's affecting all of you, I know. 80 hospitals around the country now have laid off employees because all of the elective procedures have been canceled, and physicians' offices, so many of them are slow and some are even closing now, minimizing staff, and so that affects everybody as well. So I know a lot of people in healthcare have been touched by this, even if you're not out there on the front lines. And so this is an hour for you. Again, the number is 800-333-1190. Love to have you call and share with us exactly what's going on in your world. There is some good news as we start the day. The site that has most people are following these days to project the hospital usage and demand for care shows that Indiana actually has peaked, if you believe those numbers. Instead of next week, we now are seeing on this website, they're reporting that we actually reached our peak just a couple days ago, and that the death toll in Indiana is going to be a lot lower than was first expected. So I think we can all credit all our social distancing and all the efforts that we're taking to make that happen. So good job, everyone. And while the phones are filling up, I do want to introduce a couple of folks with us today from St. Francis University School of Nursing. They're in the studio with me, so we're going to hear about how this is affecting their students and those young people just jumping into the world of nursing. So I'd like to welcome Terry Roberts. She has a Master's of Science of Nursing, is Assistant Professor in the Department of Nursing at St. Francis, and also a Community Health Nurse Consultant. Terry, good morning.
Good morning.
And also with us is Caitlin Krause. She's a Doctor of Nurse Practice and a Family Nurse Practitioner. She's also Assistant Professor and Graduate Nursing Program at St. Francis. Good to have you here, Caitlin.
Thank you. Thanks for having us.
All right. So what are you hearing? What are students or former students telling you about what they're seeing out there in the world?
Currently, I work with family nurse practitioner students, and they are already registered nurses. So there are a lot of them on the front lines right now. I have a student that I just talked to the other day who works in the emergency room, and she describes the feeling that she goes into work with every day as one of unease that she has not experienced before, but that she also realizes it's what she's been called to do and called to serve. So she states that, it's a scary time, but she's prepped and she feels good, and she wants to help as much as she can.
Yeah, I think that calling is what got you into the career in the first place, and you feel it even more strongly now. Terry, what's going on that you're hearing?
Well, my students are BSN students working towards that 4-year degree, as well as recent graduates. So I have everything on the spectrum from, am I going to pass my classes with this new way of learning, which maybe isn't their first choice of learning style, up to, boards and those being postponed to test for their licensure, and new graduates and working students currently dealing with the risks and protecting themselves as well as their families. So I actually have some students who have banded together and isolated together that are working their jobs and then going home and living in the same house to protect their families who have health risks or are immune compromised. So kind of that spectrum.
Yeah, that's tough. Bringing that virus into the house is a big concern for a lot of people in the clinical environment. Put your headphones on, ladies. We're going to jump out to the phones. We want to hear from Pat. Pat, tell us what's going on in your world.
Well, do you think, as I do, that the way President Trump can open the society again safely is to use his authority as commander-in-chief to command that the soldiers that have coronavirus take zithromycin and
I think you're probably chloroquine, right?
To prove to people that that coronavirus is not a death sentence.
I'm going to stop you there, Pat. We're going to move ahead to.
Has made people believe this.
We're going to move ahead and see what these ladies are hearing about that.
Quote,
I know in our second half hour, we're going to be hearing from Dr. Jamie Rutland, who is just going to be coming off an ICU shift. He's an intensivist in Los Angeles area, and he's got some real thoughts about hydroxychloroquine. What are you hearing clinically?
I think this is a really tough question because in the United States and across the world, we tend to have really strict guidelines for a reason, to make sure things are very safe before we give them in large quantities to all types of people. We know that things have side effects, and we want to keep the safety of patients at the forefront. So we know that there's a lot more testing that's needed. And I think, we look at that as just a small piece of the puzzle. We know that we need to be testing more patients. We know that we need to start looking back at antibodies of people who've maybe had it and been asymptomatic in the past. So I think that has a piece of the puzzle, and hopefully there's some good research coming out soon, and the FDA hopefully will fast track it if it shows that it's helpful. But I think there's a lot more research and looking at it that needs to happen before we're giving it, at least in large quantities, to the general population.
I want to back up a second here. We're talking about the emotional impact on healthcare workers. Am I making too big a deal out of that? Is there going to be PTSD in that group after this experience?
That's absolutely a legitimate concern, not just for healthcare workers, but for all the services that are working right now and providing food and grocery and healthcare as well. But I do believe personally that the mental health component and the after effects following the pandemic will probably be larger and last longer than the pandemic itself, as we try, to serve all those needs for mental health existing already, that's exacerbated by isolation, for example, where diagnosis was already made, that will, exacerbate those, as well as new trauma. And we've worked locally on trauma-informed care, actually, for the last year and a half with Great Kids, Great Communities, and I feel that training and that work that we've done, we'll be able to implement to address a lot of that following all of this.
I think what's interesting, too, is healthcare providers, and I know us as nurses, we can specifically speak to this, that we went into the field because we know that we're patient-centered. We want to be there for our patients. Every decision we've made in our nursing history has been at the forefront of patient needs. And so it's hard as a healthcare provider right now to have that argument about, what do you do to step forward and also then come home and protect your family, and you want to make sure you are at the center of the patient care, but then, you're worried about your own health and the health of your kids and the people you come in contact with on a daily basis. And the other piece of that is in nursing, being patient-centered, we're taking that out of a lot of these situations, and that we can't control it. Family members aren't allowed to be at the bedside during end-of-life care issues, and I think that kind of stuff is what's going to be the biggest traumatic piece to deal with at the end of all of this. So, technology, thankfully, nowadays with iPhones and things can put patients FaceTiming right in front of the patient, but it's just not the same as laying hands on a patient, and I think we as healthcare providers really struggle with that.
And we have the phones open for you if you are a healthcare worker and want to share your stories, your experiences, how this whole COVID thing is affecting you. We're here to hear about it at 800-333-1190. Again, 800-333-1190. Or text us at 46862, and we'd love to hear from you. So in the studio with me are Terry Roberts and Caitlin Krause, both from the St. Francis University School of Nursing. I am told you have about 70% of all of Northeast Indiana, and the nursing team comes out of your program, right?
That is definitely true.
So what are these people doing when they're getting off shift and coming home to protect their families?
I've heard from several students that are working as emergency room nurses and ICU nurses, and they have little kids at home, and obviously that's probably their number one priority. And some of them have even resorted to having their kids live with in-laws or somebody else in the family to avoid coming home and bringing some sort of illness home to their kiddos. So I think that's one of the more extreme situations that healthcare workers are having to face right now.
Yeah, the part of that emotional burden. I talked to a respiratory therapist in Indianapolis who told me that in their unit, when a patient codes and they have to do CPR, chest compressions, they're now putting a tarp over that patient before they touch them. So they're already in PPE, full head to toe, and then they put a tarp over the patient to do the compressions. And she said that lack of personalization that this is causing is really an emotional burden. So how do you teach students to deal with the emotional side of that type of issue?
In our class, we talk a lot about, that's just at the core of nursing. We talk a lot about what makes somebody a unique individual. What's the dignity of life? And how do we provide patients with a sense of humanity? So it's really difficult in these situations to kind of overcome that natural inclination to be a hands-on, lay your hands on the patient, touch the patient. So I think we're overcoming that right now, and what we teach our students is things like social determinants of health and, that dignity of life, and how else we can accommodate that. So that's where technology's been really helpful, or we've seen nurses and doctors who have a picture of themselves taped to the front of their gown, so that the patient can actually see, this is what I look like without a mask. This is what I look like without all of this gear on. So I think that kind of stuff is what's hopefully bringing a little bit more humanity into what seems like sometimes an inhumane healthcare system today, unfortunately.
We also focus, of course, in curriculum on, as you mentioned, the Franciscan values, especially at St. Francis, but social justice, respect for everyone, as well as wellness for yourself and coping mechanisms, as you touched on, when you are going through difficult situations, and finding that way, that outlet to take care of yourself as well, so that you can dress up and go back in.
Yeah, the John Wayne syndrome is what I've heard it called. So you're going to be tough. You're just going to gut it out. You're going to tough yourself through this. So I have heard that there's a lot of pressure in that healthcare team. You may be having a weak moment, but you're not going to show it. You're just going to soldier on and break down later.
Mm-hmm. Yeah, and I think that goes back to our conversation about what's our world going to look like when all of this kind of wraps up, and what kind of grief are we going to have left over, not only from healthcare workers but family members who weren't able to have proper funerals and grieve their loved ones, the loss of their loved ones, and people who've lost their jobs and stuff. So I think that the after effects, we've all been trying to tough it out and day by day kind of live our lives, but I think when we look back at this, there's going to be a lot of people who have been impacted and are trying to figure out how to deal with that after the fact.
And let's talk about how this is going to change healthcare. What kind of trends do you expect that we're going to see?
Well, I know we've talked about virtual health as just one piece of it, and that was already on kind of the forefront, and there was a lot of work being done towards that out, and especially in our rural areas and with our vulnerable populations and so on. And now I understand, and I hear from you, Caitlin, that you feel this is just going to be probably a stimulus to push that forward and utilize it as routine.
Yeah, I think we've used it a lot, or we've tried to figure out how to use it with mental health care, which is huge in our country. And so that is where I think we've used a lot of telehealth visits, but now we're realizing we can do it for a lot of other things. I volunteer weekly at Matthew 25 and take care of a lot of uncontrolled diabetes and hypertension. And I think we're realizing that, we can take care of these patients from farther away without having them to get on 4 buses to come in and see you in the healthcare clinic, when maybe you can check in with them virtually. And I think that will really change the way we deliver healthcare.
I think of the benefits of that as well when you talk about compliance.
Yes.
So now we're coming to you, and what I say to my students is we bring them out into the people, but if you can bring that healthcare into their home and that access has opened up, the compliance being better, health being better for the community as a whole.
We also talk a lot about having healthcare providers work to the top of their license, to the top of their education and training. And we've seen now through executive orders across the states that we've really tried to remove legislative barriers and allow healthcare providers to do what they're trained to do and to deliver care to patients. And that is really important in our healthcare industry, and I think that will come forward even more as we wrap up with the pandemic.
So the disease seems to be the most serious in extended care facilities, in nursing homes, and I mean, it makes a lot of sense. Confined space with a highly vulnerable population. What are your students being called upon to do, and is there more demand for people at that early stage of training to get into those care centers?
Yeah, so in our professional organization here in Indiana, the Coalition of Advanced Practice Registered Nurses of Indiana, we've taken all of our nurse practitioners and certified nurse specialists and all of our students as well, APRN students, Advanced Practice Registered Nursing students. Sorry, I'll try not to use all of our abbreviations, but and we have partnered with the Indiana State Department of Health and all the local health departments along with the Indiana National Guard, and we are serving on strike teams right now. And what that means is that we're volunteering to go into these long-term care facilities and do testing on any patient that might have symptoms or maybe is a high-risk patient to see if we can catch any early outbreaks and make sure that that doesn't spread throughout the nursing home or the long-term care facility in a very fast and quick manner. So that is one step that's being taken across the state.
Huge. And then locally, there's a lot of work being done right now behind the scenes with collaboration between nursing schools, the Department of Health, and extended care facilities, and attempts to get a fast track for BSN students, even undergrad BSN students, who can come in to the extended care facilities and give relief to the nurses, allow them to do their jobs, and also as this front line might start to deteriorate with illness, come in and assist. So that work's being done here too.
We're going to start looking ahead to the second half hour of the program, and Jamie Rutland is going to join us. He's been on the program several times with us now. He's a pulmonologist intensivist who's coming off an ICU shift in the Los Angeles area. But, I have to admit, I'm really, frankly, kind of surprised we haven't heard from some of the healthcare workers out there. Here's your chance to tell us what's going on in your world and how is this thing rocking your world. So I hope that you will give us a buzz as we continue into the second half hour. Numbers 800-333-1190 or toll free at 46, and that is the toll-free number. You can also text us at 46862. So we're going to continue to hope that we hear from you healthcare workers, and then we're back just after the bottom of the hour with jumping out to Los Angeles, and we're going to hear firsthand what's going on in an ICU there. So stay with us. There's more of the HealthCall Live Radio Hour on WOWO, 1190 AM and 107.5 FM.